Safety tip number 7 is a recommendation to use lidocaine with epinephrine in a single commercial vial rather than using lidocaine and epinephrine from separate vials. And my suggestion is that most people use lidocaine with epinephrine prepared in a single bottle. This contains 30 ml of lidocaine, but you can purchase 50 ml vials of lidocaine with epinephrine 1%, and that can be used to be placed inside the bag, the IV bag, for preparing tumescent lidocaine anesthesia. Alternatively, you can use just plain lidocaine and then add epinephrine. So here's these little vials, 1 milligram of epinephrine, and this is 50 milliliters of lidocaine, or 500 milligrams of lidocaine. So 2 of these 50 ml vials will contain 1 gram, 1,000 milligrams of lidocaine, and 1 milligram of epinephrine can be placed inside the bag for tumescent anesthesia. But if for some reason, and this has happened, the person who's mixing the bag of tumescent lidocaine puts the lidocaine in, but forgets to add the epinephrine as a separate addition, then the lidocaine, it has no epinephrine, and the rate of systemic absorption of lidocaine will be greatly accelerated, and then it can actually become dangerous, and potential toxic levels of lidocaine, serum lidocaine levels, can be achieved. So as a safety measure, I recommend lidocaine with epinephrine be used. We have often used, patients are often given more than 1 liter of tumescent lidocaine. So you will have 2 or 3 or more bags of lidocaine, tumescent lidocaine anesthesia. Each of those should be numbered. And also, each of the vials that are used should be placed in orders on a counter that can be easily seen. So we will have, for example, a row of bottles of lidocaine with epinephrine, and if we had 3 liters of saline used for tumescent lidocaine anesthesia, then we would have 3 rows of these vials that were empty, so that at any point in time I can look over the counter and see that yes, there are 3 rows of vials that are empty, so that actually was placed in an IV bag, and I know exactly what was placed in there. There's a bit of a danger if this is prepared out of the operating room because you can't see it, and it's even more of a danger if it's prepared, say, in a central pharmacy, because you have no idea what the pharmacist put in there. Usually hopefully they'll be accurate 99.99% of the time, but that one time where there's a mistake, you'll have no way of knowing what was actually in the bag, and it's a bit disconcerting not having that security. I do know of one event that did happen in which the tumescent lidocaine was prepared in a central pharmacy, and instead of using 1 milligram of epinephrine, 10 milligrams of epinephrine were used, and the patient had a cardiac arrest. They survived the event, but it was an unnecessarily traumatic experience for everybody involved. So it's nice to have it prepared in the OR. The last thing is bicarbonate. We use bicarbonate in each of the bags, and this is to reduce the pain, the stinging pain of infiltration of tumescent lidocaine. Commercial vials of lidocaine, such as this, have an acidic pH, and the purpose is to give better half-life for the epinephrine. The epinephrine will denature itself in neutral pH within a matter of weeks. So the shelf life is not very good unless it's in an acidic environment. Also, an acidic environment improves the solubility of lidocaine and other similar local anesthetics. So, putting in 10 milliequivalents of bicarbonate in each bag decreases the burning sensation that can be associated with tumescent local anesthesia. And by decreasing that burning sensation, you can minimize the need for any other ancillary sedatives or analgesics. In our office, in our surgery center, we do not give patients narcotics or heavy-duty IM or IV analgesics. It's not necessary. We infiltrate very gently and carefully and do not require any other medications. But if you don't use the bicarbonate and it stings, you're forced to give patients other medications just to overcome that. I'm Dr. Jeffrey Klein. Thank you for watching this informational video.